Hello, students. So we are going to talk about the endocrine system. This is one of my favorite systems to talk about because it's so important and it's so fundamental for our development and reproduction and just our daily functioning. And of course, any deficiency in any of these organs will be very impactful to our daily lives. Here we see some of them just for like a little review. We have the hypothalamus, then the pituitary gland, we have the pineal gland. We see the parathyroid glands as well here. There are these little ones in the back of the thyroid. We have the thyroid gland here. We have the thymus as well. We have the adrenal glands, which are located on top of our kidneys here. And we have our pancreas, which is just shown a little bit here in this area. Okay. Also, we're going to talk about the ovaries and its counterpart in the male, which will be the testes, right? These are pretty important because any deficiency in any of these guys will impact our daily lives. So, endocrine system versus nervous systems. We are familiar with these two, and they connect to each other to some degree, but the way they transmit signals is different. So, for a bigger picture, the endocrine system is slower than the nervous system. Okay, so why? Because the endocrine system uses the bloodstream as its highway and means to transmit information, while the nervous system uses electrical signals. The messenger in the nervous systems is known as a neurotransmitter or neurotransmitters in plural, and we use hormones in the endocrine system. As I said before, its speed is slow while it is very fast in the nervous system. Just think about a nervous reaction that will makes us have the flight or fight response, and think about how fast that one is. Also, its duration, while in the nervous system is super fast, usually tends to be short lasting. Okay, and in the endocrine system, it tends to be long lasting. Okay, target tissues, depending on what hormone we are talking about, it will target all the body's systems, while the nervous system will be more specific, either muscles or glands. And this is when I talk about the interconnection between these two, right? Glands. And when we're thinking about glands, we are talking about also the endocrine system, okay? So the effect, well, in the nervous system, we either are wanting to do something, such as if we burn, we want the muscle contraction to move that part of our body that is burning, or the gland secretion. In this case, if we're getting scared, we're going to have a spike of adrenaline to have a response to that thing that is scaring us, right? And then if we go specifically talking about the endocrine system, we're going to talk about the homeostasis, keeping that balance in our bodies, okay? Organs, they're going to be scattered throughout our bodies, okay? And they're unconnected because they are using the bloodstream as the connection between them, okay? And then in the nervous system, the organs are interconnected throughout the entire body. Nerves are connected, right? So the functions of the endocrine system are pretty important, and they happen through the beginning of our lives, daily lives, and to the end of our lives. Okay, so they control reproduction, growth, and development. They prepare our body to combat stress, either if it's acute or if it's chronic. Think about if we get scared, we're going to have a spike of adrenaline. But also, due to our works and our modern lives, we are basically chronically stressed too, okay? Also, using other hormones, we're going to have electrolyte balance and water balance. Think about the ADH or the renin angiotensin system that we use to conserve water and keep our blood pressure at good levels. Also, as I mentioned, blood pressure related to this, guys, right? Okay, and also maintaining the nutrition balance or nutrient balance. Think about glucose. We want to have certain amount or certain level of glucose in our blood, but also enough to be nourished, right? And also regulating cell metabolism via the thyroid hormones, right? Also, they help us to increase or decrease cellular activity by changing plasma membrane permeability, synthesizing hormones, or through other enzyme functions, okay? So when we think about the endocrine system, I want you guys to think about hormones, okay? That is the main messenger that the endocrine system is going to use to transmit those signals. The whole point of the endocrine system is to keep that homeostasis, which means the balance. Okay? And if you recall your previous API course, an endocrine gland creates its messenger, meaning the hormones, into the bloodstream. Okay? Into the bloodstream. Okay? And basically, a hormone is a chemical substance. It could be either lipid based or amino acid based that is going to be secreted and then go through the bloodstream and target other cells in the body. Okay? That cell or tissue in the body is going to either be called a target organ, or if it's a group of cells, it's going to be target cells. Okay? And as we have talked about before, like the example of antibodies and antigens, it's something similar here. A hormone can act on a tissue or a cell if they have the correct receptors to that hormone. Okay, think about a key and a key lock. Otherwise, they will not respond. And that's important because if you think about it, if all the cells have all the receptors, it will be a very messy business. Okay, so a hormone travels to its target tissue using what? The bloodstream. Okay, so we have two different kinds of glands in our body. We have endocrine glands and exocrine glands. So they will have a different function and also very different structural differences. Starting by the exocrine ones, so we can get them out of the way, they all have ducts, okay? And let me just highlight that bad boy pretty good for you. They have ducts, okay? And they produce non-hormone substances. Think about if they have ducts, think about the sweat glands, oil glands, and salivary glands. They are not hormones, okay? They produce other substances and they have ducts, okay? In the case of endocrine glands, they are ductless glands that produce hormones, all right? And they use the bloodstream as its highway, okay? Or distribution means, okay? Think about the pituitary gland, the thyroid gland, or the adrenal gland. We can have organs that are mixed. For example, the pancreas. It has ducts for its exocrine function, but also has the islets of Langerhans for its endocrine function. Okay? So hormones can either be classified by its structure. They can be amino acid based or steroid hormones, which are lipid based. There is a third kind considered by some scientists, and they're called eicosanoids, and we're going to talk about them in a second, okay? So continuing the classification of hormones by structure, there are ones that are amino acid based, meaning that they are coming from either amino acids, peptides, or proteins, okay, depending of the length of their chains. So they are hydrophilic hormones, meaning that they are water-loving hormones soluble in water. Okay, an example of them is the growth hormone. Okay, then we have the steroid hormones, meaning that they are derived from cholesterol, which is a kind of lipid. Okay, think about water and oil. They don't mix, right? So they're water-fearing, non-polar, or fat soluble. Okay, they're not very common, and they come usually from the gonads, testes, or ovaries, or the cortex of the adrenal gland. And we're going to talk about a lot of them later throughout this presentation. Okay, an example of this one is testosterone, estrogen, or progesterone. And usually we give a very colloquial name to this kind of hormones. We call them steroids, but steroids are a bigger gamut of hormones. Okay, then we have the eicosanoids. These are hormones that are released by nearby cells, okay? So just like a little neighborhood of cells. They're made out of lipids, and basically they have a localized action. For example, an infection or a dying cell, that the whole point will be to release a signal in the vicinity of cells, okay? Such as inflammation, all right? So we have cells talking to each other, okay? So just like a neighborhood of cells. Okay? So now we have hormones that can either be tropic or non-tropic. What do we mean by that? So the tropic hormones are hormones that are going to stimulate another endocrine gland to secrete other hormones. So basically it's like a relay game. I have the gland that is going to secrete a hormone to stimulate another gland, so this gland can secrete the hormone. Okay, and here are some examples. Okay, luteinizing hormone, follicular stimulant hormone, ACTH, and TSH, thyroid stimulant hormone. The non-tropic ones basically are the ones that go straight to the point, meaning that they're gonna go directly to the target cell, and those are the non-tropic. Okay, they go directly to stimulate the target cells. In this case, we're talking about the growth hormone or prolactin. Okay, so what causes a hormone to be secreted? So there are three pathways. We either have a hormonal stimulus, and think about this one as the tropic hormone. So a hormone is the first one to trigger that secretion to secrete the hormone. Okay, then we have the humoral stimulus, meaning that the levels of nutrients, ions, or salts in the blood are stimulating the secretion of the hormone. The one that you guys can think about more commonly about, it's insulin, because if you think about a nutrient, in this case meaning glucose, is elevated, so we need to secrete insulin so those glucose levels can go down. Okay, and then a neural stimulus is released by the stimulation of nerve fibers. Okay, and then in the bottom it says the concentration of a hormone circulating in the body depends of how much of the hormone was released from the gland and the speed at which hormone is inactivated or removed from the body. Okay, here we see a little bit more like a representation of those stimulus. So we have a humoral stimulus, and we're talking about the PTH, a parathyroid hormone. This one is designed to increase the level of calcium in the blood. So if our calcium is low, PTH is going to be secreted so we can either reabsorb calcium through our intestines or using the osteoclast in our bones to just like carve a little bit of calcium out of our bones. Okay, the neural stimulus, we see it here. Think about you getting scared or something is heighten your senses, and you are going to secrete what? Adrenaline, right? And adrenaline acts very fast, very quick, and gets you up to either fight or flight, right? And then the hormonal stimulus. Here we see the pituitary gland, okay? So here we're seeing hormones that are going to stimulate the release of hormones in another glands, okay? Either in the thyroid to produce the thyroid or thyroxine hormone, or the adrenal cortex for all the group of the steroid hormones that are produced in the adrenal cortex, or in the testes to produce what? Testosterone, right? So what actions can a hormone trigger? Okay, so first we have to have the hormone that is going to attach to those target cells via the receptors. Okay, so we have to have the right key to the right key lock. So they're going to stimulate the synthesis of a molecule, activate or deactivate enzymes, alter the membrane permeability, allowing something to go inside the cell, okay? Or stimulate mitosis, meaning cell division, okay? So controlling hormone secretion, how the secretion of hormones is controlled, okay? There's either a negative feedback loop system or a positive feedback loop system, okay? From these two, the negative one is the most common ones for hormone secretion control, okay? Basically what we want to achieve with this one is balance, homeostasis, okay? So what happens, let's say for example, we just ate and our blood sugar is gonna spike, all right? So what's gonna be secreted is insulin, okay? So that glucose can go inside the cells, okay? So usually the normal levels for glucose in our body should be between 60 and 110. So the secretion of insulin is gonna help us to go down. But we don't want to go too low. We want to be in this beautiful number, all right? So once we achieve the numbers between this threshold, we're going to either slow or stop the production of that hormone, okay? And if we eat again, we spike and we produce again insulin, so we go back again to this level, right? Okay, so with a positive feedback loop, it's kind of different because we have a stimuli that is going to trigger the production of a hormone. For example, the baby's head is going to press against the cervix and the uterine walls, and that is going to produce or stimulate the secretion of oxytocin that is going to help us with contractions. Okay, so long or as long the kid is pushing against those walls, we're going to have the contractions until baby is gone. Okay, kind of the same thing with milk ejection. Someone has to be suckling to keep that secretion. Okay, here is kind of like a little bit more in graphic ways. So you eat, all right, so your blood sugar that is super high is going to secrete what? Insulin from the pancreas. All right, so the blood sugar that you don't use is going to either be stored either in fat or in the form of glycogen. Okay, this is going to be your reserve. So if your blood sugar goes low, there's a little bit of storage. Okay, and your blood sugar goes to a normal level. As I told you guys before, is either between 60 and 110. So we always want to achieve a balance. Okay, then the feedback loop that is positive is there is a stimuli. So baby's head is pushing against the cervix. These nerves are gonna be transmitted to the brain. The brain is gonna tell the pituitary gland to secrete oxytocin. Oxytocin is gonna be carried through the bloodstream to the uterus, and we are going to start to have contractions. If you guys are hearing that squeaking, that's my parrot. Now, positive feedback loop. This is another example. Baby is suckling. The suckling sends impulses to the hypothalamus to release oxytocin. The oxytocin released in the bloodstream is going to go to the breast and stimulate what? The milk ejection. Okay, so long baby is doing that, the stimuli is going to be there, and this effect is going to happen. Okay, now we're going to talk specifically about organs. Okay, so the first one, and we're going to go from the top to the bottom basically, it's the hypothalamus. Okay, and it's this little friend here. Okay, so this one is considered a neuroendocrine organ and the master control center of the endocrine system. Master control center of the endocrine system. Okay, this structure is in the brain. It produces and releases hormones that act on the pituitary gland. Okay, but also has a higher brain function: thirst, hunger, body temperature control. This is where Tylenol acts when we have a fever. Okay, for the purpose of the endocrine system, I want you guys to think this is the boss. When we start everything is the C-suite, and this one is going to produce and release hormones that are going to act on the pituitary gland. Talking this friend here. Okay, it communicates to the two different parts of the pituitary gland. The pituitary gland has an anterior piece and a posterior piece. Okay, the anterior piece has more of a glandular structure, and it connects via the hypophyseal portal system. It's a system of vessels. Okay, the posterior part has a structure more similar to the nervous system, and it connects to that piece by the hypophyseal hypothalamus nerves. Okay, anterior, posterior, and this is pretty important because we're going to see later there are only certain kinds of hormones that are going to be produced in the anterior part, and some kind of hormones that are going to be released from the posterior part. Okay, Now, hormones that are produced in the hypothalamus. Okay, we have four. And look at the names, they follow a pattern: thyrotrophin releasing hormone, okay? Corticotrophin releasing hormone, gonadotrophin releasing hormone, growth hormone releasing hormone. So the emphasis and the silly way that I'm pronouncing this is because they I want to make emphasis and these guys are acting on a gland to release another hormone. Okay? So also the hypothalamus produces two inhibiting hormones. Okay? So we have prolactin inhibiting factors and growth hormone inhibiting factors. Okay? This is to stop the production of certain hormones because we don't need them at some point. Okay? All right, so moving down to the pituitary gland, also known as hypophysis. Okay, so for purposes of this presentation, we're just going to refer to it as pituitary gland. Okay, this hormone, or I should say this gland, sits on top of the cell turca of the sphenoid bone. Okay, so I'm going to use the blue color to signal the anterior part, and now I'm going to use the red one to signal the posterior part. Okay, so this is when I talked to you guys that it's also called hypophysis. Okay, so the anterior pituitary gland has more like a glandular structure, and that's why it's called adenohypophysis. Adeno means gland, so that's the glandular hypophysis. Okay, and then we have the posterior part that is also known as neurohypophysis, giving the structure that is in that gland. So it has a more like neurological nerve tissue structures. Okay, it is suspended basically or connected to the hypothalamus via the infundibulum. It's a funnel shaped stalk. All right. All right, so we're gonna start by the posterior pituitary gland, also known as neurohypophysis. Okay, so the reason that it's called neurohypophysis is because is composed of neural tissues and nerve fibers. Okay, this one receives and releases already made hormones. I am going to stress that again. They're gonna receive and release hormones. No hormone is being produced here. Okay, we are receiving oxytocin and ADH from the hypothalamus and store it there. Okay, it's a hormone storage area rather than a true endocrine gland. Okay, as I said, the hormones truly come from the hypothalamus and they're stored here and then released when needed. Okay, so the first one that we're going to talk about is the oxytocin. This one, of course, we have heard it when we talk about childbirth. Also stimulates ejection, okay, ejection of the breast milk, but also plays an important part on sexual arousal and mother and child bonding, okay? Then we have the antidiuretic hormone. We have talked about this one before with water conservation and volume in the blood. So anti means against diuresis. So this one is the hormone that is going to decrease the urine production, meaning that our blood volume is going to go up, but the urine is going to go down. Okay? So ADH and oxytocin are going to be stored and released in the posterior pituitary gland. Here we see it. What we are seeing here is the hypothalamus and the connection of the hypothalamus to the posterior part of the pituitary gland via nerves. And then those hormones, once released, are going to go through the bloodstream. Okay? So on this one, I want you guys to pay attention because now we're moving to a part that is meatier and it's a little bit more complex. And as you guys noticed with the hypothalamus hormones, many of them said releasing hormone. This one is going to say stimulating. And the reason for that is because they're going to stimulate an action on another gland, meaning there are also tropic hormones. Okay, so the first one at the top is thyroid stimulating hormone, and as the name says, it is a dead giveaway. It's going to be a hormone that is going to go to the thyroid to stimulate the production of the hormone. Okay, so this hormone is going to be controlled by what? The thyroid releasing hormone to produce thyroid stimulating hormone, with the end result to go to the thyroid and produce what? Thyroid hormones. Okay, you also, and more often than not, will see it as TSH. Okay, then moving down, we have the luteinizing hormone, and depending if you're female or male, biologically speaking, you are going to have different reactions to the hormone. Okay, so in the females, it's going to cause the ovulation of mature eggs from the ovary. Okay, ovulation of the mature egg from the ovary, and also the production of estrogen and progesterone, two important hormones. One is for the female sexual characteristics, and the piece that is going to help us with the implantation of a or an embryo. Okay, the part below, it says if you're a male, is going to stimulate the secretion of what? Testosterone, which is important for the growth and development of males, but also the secondary sexual characteristics in the male. Okay, and then we have the follicle stimulating hormone. Follicle stimulating hormone, another tropic hormone, meaning that this guy is gonna go where, depending if you're biologically female or male, to the maturation of the eggs. Look, it's different than this guy here, meaning that this guy is gonna help with the maturation of an egg so it can be released, which is helped by this guy, right? And then the production of estrogen as well. Okay, female secondary characteristics. In the male, is going to be different because this one is going to help with the maturation of sperm and testosterone production. Okay, so take your time to see this and where they act, because depending of the biological gender is going to be different, with the difference that this one on the top, there is always going to act upon the thyroid. Okay, guys, continuing with the anterior pituitary gland, we see three more hormones. When we see prolactin, I immediately think about milk. Okay, so the prolactin helps with the development of breast tissue and the production of milk. Pretty important, not the ejection, because that one is the function of oxytocin. So this guy helps with development of breast tissue and the production of milk. All right, males produce small amounts of this, but there's no clear function yet. Funny enough, if a male has a tumor in this piece of the gland, we can have development of breast tissue and even some leaking, but it's not a common occurrence. Okay, below we see adrenocorticotropic hormone. Okay, this is another tropic hormone, right? So this guy is gonna help us to release certain hormones in the cortex of our adrenal gland, and it's going to help us release corticosteroid hormones, specifically glucocorticoids and androgens, and we're going to talk about them later. Okay, and then we got the human growth hormone. This one is a hormone that directly acts throughout our body. I'm pretty sure you guys have heard of that hormones, either by hearing how important it is for our development, but also some people use it for cosmetic reasons. Okay, so what does it do? So it stimulates bone, skeletal muscles, and adipose tissue, cell growth, reproduction, and growth of the skeletal system. This guy is produced mainly at night while we sleep, and that's why it's so important to have a good sleep routine, especially when you are a kid. Here is the graphic representation, so we are talking about the anterior part. And if you guys see, the connections here are more like vessels, all right? So you see the connections here, and this one is known as the hypophyseal portal system, okay? Now let's talk about the pineal gland or pineal gland. I'm gonna say that again, pineal gland. So marry this one with the production of melatonin. Why is melatonin so important? I'm pretty sure, I don't know, maybe some of you take melatonin to aid what? Your sleep. So especially this one helps to regulate the circadian rhythm, aka your biological clock, okay? If this guy goes out of wax, it can throw a wrench in your basically functioning. It also affects the timing of sexual maturation and puberty, okay? Moving down, we are going to talk about the thyroid gland. And of course, it's close to who? The thyroid cartilage, okay? So what does the thyroid produce? Well, it produces mainly thyroid hormones, T3 and T4, either is inactive or inactive form, and also another guy, calcitonin. Marry this guy and learn the difference between this guy and the other hormone we're going to talk about later. Calcitonin is going to decrease the levels of calcium in the blood, okay? Calcitonin is going to decrease the calcium levels in the blood. When we think about the thyroid hormones, think about metabolism. The more thyroid hormones is increased, the faster and spendier, let's say it that way, your metabolism is going to be. And that's pretty important because when we talk about the deficiencies, it will make more sense, okay? So again, the thyroid produces thyroid hormones and the calcitonin, okay? So we see it here. The thyroid has a right and a left lobe, and then it also has an isthmus, okay, that connects both lobes. Some people tend to have a pyramid that goes this way. You can see it or you cannot see it. It all depends on the person, okay? So this is a histological sample of the thyroid, okay? So what we're seeing here is something that looks like pools. Is basically a histological sample of the thyroid, okay? These guys, or these little circles, are gonna be called thyroid follicles, okay? So the surrounding cells around that pool, they're called follicular cells, okay? And the content of that pool, you know, I'm gonna use that analogy because I think it's kind of like clear. It's called colloid, okay? Going back again, we are going to have colloid, the content, and then we're gonna have the follicular cells, okay? The whole pool is called a follicle, a thyroid follicle, okay? There are other group of cells that are going to be around the follicles, and it's something is around is either peri or para, right? So these guys are going to be called parafollicular cells, okay? And the space is known as follicular space. Why is this important? Because the thyroid hormones are going to be produced here, and then the parafollicular cells are going to produce the calcitonin, okay? So the parafollicular cells produce calcitonin, and in the colloid and in the follicular cells, we're going to produce the thyroid hormones, okay? Okay, so the hormones of the thyroid gland, we have two kinds. We have T3 and T4, okay? So T3 is triiodine thioronine, and then we have thyroxine, okay? They're produced by the follicular cells, okay? And it's pretty important because they help with the metabolic rate by regulating oxygen consumption and heat production of the body cells. Also help with the transcription of metabolic genes, okay, which is pretty important, and also the development of the normal skeletal system, normal nervous system, and reproductive capabilities. It is pretty important because when these things go out of whack, it shows up very evidently. And when we talk about the disorders, it will make more sense. So think about the metabolic rate, heat, but also development of the skeletal system, nervous system, and the reproductive capabilities. Okay, it also helps to maintain the blood pressure. Okay, so a good balance of this hormone is pretty important. And if you know anyone who has either have hypo or hyperthyroidism, think about how they look, think about how they act, think about how they present, and the treatment that they need lifelong for that. Okay, and then we have the calcitonin. It's also produced in the thyroid, but where? In the parafollicular cells. Okay, and a normal, they don't do much. What they do is when they are high levels of calcium, the parafollicular cells are going to help with the production of calcitonin, so calcium goes down, either storing it in our bones or through the feces. Okay? Okay, and this is just a little representation. Don't get too loose on this. So what we're seeing on our right, it's a capillary. Okay, so something I forgot to mention, and it was in your slides, is that the production of the thyroid hormones is very dependent on a very important nutrient known as iodine. Okay, think about where iodine is present in all our diets, which was not a thing in the past. Okay, so iodine is kind of like the PBJ of our sandwiches to produce the thyroid hormones. Okay, so we consume nutrients that are rich in iodine. They go through our capillaries, and these are the follicular cells. Okay, so we're looking at the follicle or the thyroid follicle here, and these guys are the follicular cells. Okay, so iodine goes in and across the follicular cells, and they're gonna be used as the PBJ of our sandwich to produce and manufacture T3 and T4. Okay, the pieces of the tyrosine is gonna either produced by these organelles in the cells, and basically what I need you to understand is the following: iodine is essential for the production of the thyroid hormones. Okay, think about is the PBJ of the thyroid hormones. Once these guys are built, are released into the bloodstream in the form of either T3 or T4. Okay? Here are the different functions and several very important functions of the T3. I'm going to let you guys read that one so we can move and continue. Okay? Then we're going to talk about the parathyroid glands. Okay, the parathyroid glands are four little, initially they're four, they can be more, but usually they're four. They're the size of grains of rice, okay? And they're behind the thyroid hormone. So this is a posterior view of the thyroid, okay? So the parathyroid hormone increases the blood calcium levels, okay? So if our blood calcium is low, we're gonna secrete parathyroid hormone, also known as PTH, to increase the secretion and excretion and absorption of calcium, okay? By either using the osteoclast in our bones to just like kind of brush the calcium out of our bones, also in our intestine by absorbing more calcium, and having the effect of increasing the calcium, okay? And this is pretty important. We talked about the calcitonin that decreases calcium and the PTH increasing calcium. So they're doing opposite things. So they are antagonistic to each other. And this balance, or this like pull and tug, is known as an antagonistic action. Okay? All right. So now continuing again, same thing that we just talked about, the functions and the antagonistic action. I don't know why this is here again. So we have talked about the thymus gland during our lymphatic and immune system chapter. So the important thing that I want you guys to remember are the following. So this is where the T lymphocytes mature and become immunocompetent. It's pretty important during our development, especially because it's actively the most at birth, and it reaches our maximum, or it peaks during childhood and development, and then starts to decrease as we age, especially at the beginning of puberty. Think about like we are growing, growing, growing very exponentially, and then at some point we plateau and we don't need that anymore. Okay? So the hormone that is produced in the thymus gland is the thymosin, and this one acts on target cells known as blah 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 lymphocytes. Okay, it stimulates the formation activation of lymphocytes, making them immunocompetent. Okay, moving down to the two glands on top of the kidneys. They are suprarenal or adrenal glands. Okay, I'm pretty sure you guys have heard of one of the hormones produced here known as adrenaline. Well, adrenaline is not the only one that is produced here, and I want you to pay attention to this one very closely because this one can be a little bit chunky and also very complicated. Okay, so as you guys have noticed, we have talked about layers and layers and stuff. Okay, and this one is not an exception. So we have an adrenal gland that has a cortex and a medulla. So we know the cortex is the outer layer and the medulla is the inner layer. Okay, so if we go to the cortex, we have different areas or zonas or zones. Okay, and this is pretty important. Pay attention to this. Okay, so the outermost one is the zona glomerulosa, zona fasciculata, and zona reticularis. Okay, fancy names, but also you can think about the glomerulose zone, the fasciculated zone, and reticulated zone. Okay, these are just fancy Latin names that stayed and stuck with these areas. Okay, so again, from the outermost to the innermost, and this is still the cortex, glomerulose zone. Okay, fasciculated zone, reticulated zone. Okay, and now let's see what they produce. Okay, the glomerulose zone produce mineralocorticoids. Okay, the fasciculated zone produces glucocorticoids. Pretty important, glucocorticoids. And then the reticular zone produces gonadocorticoids. Okay, glomerulus zone, mineralocorticoids, fasciculated zone, glucocorticoids, reticular zone, gonadocorticoids. Okay, and then in this area there are two very simple hormones that we're gonna hear and we're very familiar with them: adrenaline and noradrenaline, or also known as epinephrine and norepinephrine. Okay, now let's move again to the cortex. Surprise, we have a capsule, we have a cortex, and we have a medulla. You guys are very familiar with this layout already. So the capsule is just like in like a encapsulating like envelope of this organ. Okay, so what we're seeing here is the cortex. Okay, so we're seeing it from here all the way down to here. As we were talking, we have the zona glomerulosa or glomerulose zone. Okay, we have a zona fasciculata or fasciculated zone. Okay, we have a zona reticularis or reticular zone, and then we have an adrenal medulla. Okay, mineralocorticoids, glucocorticoids, and gonadocorticoids. Okay, and adrenaline and noradrenaline. Take your time to memorize, or more than anything, comprehend these layers. I assure you, this is going to be on your test. All right, so now let's talk about the layers of the cortex. Okay, so aldosterone is a mineralocorticoid. Okay, the aldosterone helps elevate blood pressure and blood volume. We talk about this guy. You guys remember the renin, angiotensin, aldosterone pathway? Remember that way. Okay. Then we have androgen, which is a gonadocorticoid. Okay. This one contributes with libido and sexual arousal. Basically, you're horny, right? And also helps with secondary sexual characteristics, and the onset of puberty. Okay? And then we have cortisol. Okay? This one influences the metabolism and also helps us resist stressors. And this one has a very important impact in the inflammation response, the cardiovascular system, the nervous system, the digestive system, and also depress the immune system and also the skeletal system. This one is one that is kind of in vogue lately because basically, given our modern way of living, we are chronically stressed. So we have an increase of cortisol, which affects our blood sugar by being increased. Also, we are chronically inflamed. We are cardiovascular stressed. We are stressed constantly, but also this one decreases our immune system, meaning that we are more exposed to what? Infections. Okay? Take your time to review these ones. These guys are produced in the different layers, but think about the layers. So we're thinking about first the first area that is going to produce mineralocorticoids, then the second area that are going to produce glucocorticoids, and then the third area of the cortex that is going to produce the gonadotropins. Okay? Glomerulus, fasciculated, and reticulated. Okay? The hormones of the adrenal glands, they are all known as what? Steroid hormones. Okay? Now, back to this friend again. So the renin, angiotensin, aldosterone now makes a little bit more of sense because think about this. What we want is to increase the absorption of sodium and water to keep our blood pressure up. So starting from the beginning, the renin is produced in the kidneys, then renin goes to the liver when it's in contact with the hormone called angiotensin, and we have angiotensin 1. Then angiotensin 1 goes to the lung and meets with the ACE or ACE, angiotensin converted enzyme, and becomes what? Angiotensin 2, which is the active form. Okay? Now the angiotensin 2 goes where? The adrenal glands, and goes to the cortex and produce aldosterone. Aldosterone is going to go to the distal convoluted tubules in the collecting ducts to increase the water and sodium reabsorption and exchange potassium with that, with the end result of increased blood pressure and volume. Okay? We have seen this many times. You guys can see it by yourselves. Now we're going to talk about the adrenal medulla. This one is the innermost layer of the adrenal gland. We have epinephrine and norepinephrine. We also know it as adrenaline and noradrenaline. Okay? So basically, these guys have an important effect on the sympathetic nervous system. The sympathetic system is highly stimulated by epinephrine or adrenaline, which is kind of like the activator. And then the parasympathetic system that is aided by norepinephrine will be the inactivator. Okay? Think about this. Adrenaline goes in, we vasoconstrict, we increase the heart rate, our blood sugar goes up, diversion of blood to the brain and the heart and the skeletal muscle because we want to do what? Fight or flight. Okay? The hormones in the medulla of the adrenal gland, they are all peptide based, also known as amino acid based hormones. Okay? Now moving forward to the pancreas, our good friend the pancreas, we have talked about it in the GI chapter. Now we're going to talk about its endocrine function. So we know the acinar cells are the ones that produce the digestive enzymes and they go through ducts, meaning what? They're exocrine enzymes, exocrine function. So just memorize or understand that the acinar cells are the ones that have the digestive function, meaning an exocrine function because they go through ducts. Okay? And now we have the pancreatic islet cells. They have either the alpha cells or the beta cells. They are hormones. Okay? In the alpha cells, we're going to have glucagon, and in the beta cells, we're going to have insulin. Okay? This one is a histology sample of the pancreas. Around all over here, we are seeing the acinar or acinar cells, okay? And they are the ones in charge of the exocrine function. This gorgeous friend here is the pancreatic islet or islet of Langerhans. Okay, we either have the alpha cells that produce glucagon, which is a hormone that is going to break down glycogen, so we get a fast source of sugar. Okay, and the beta cells kind of act as an opposite, because the insulin, what it's going to do is decrease the blood sugar in our blood by allowing that glucose to go inside the cells, with the end result of decreasing the blood sugar in our blood. Okay, so the hormones in the pancreas, we're talking about the alpha cells first. They secrete glucagon. Okay, glucagon, not glycogen. Memorize that, understand that. Okay, so this one is the one that's released between meals, because if you're not eating, you're not getting basically the important glucose and nutrients. So you have to have a little storage, a little stash, so your blood sugar stays in level. Okay, so this hormone what? Raises the blood sugar levels. Okay, it triggers by breaking down what? Glycogen. Glycogen is usually stored either in the liver or in the muscle. Okay, the beta cells secrete insulin, has kind of an opposite effect. Okay, it's released during and after meals to what? Decrease the blood sugar and put it back to baseline. Okay, this hormone what? Lowers blood sugar. Okay, and enhances the transport of glucose into what? Fat, muscle cells, and inhibits the breakdown of glycogen, because what we want to have is our stash back. So in the time we are in between meals, we can break down that glycogen, so we can spike our blood sugar again and have what? Balance, homeostasis. And we see it here. This is a clear example of balance homeostasis in a negative feedback loop. Okay, so here we ate. Okay, our blood sugar goes up. The stimulus of blood sugar increases the secretion of insulin, and cells are allowed to take the blood sugar in. Blood sugar goes down, but now we don't want to go too low, so we produce glucagon to break down glycogen. So our blood sugar goes up, but we don't want it to go all the way up. It keeps a balance. Okay, now we're gonna go down more, and we're gonna talk about the ovaries and the ovarian hormones. Okay, so we're talking about the female pieces. Okay, so the ovaries produce estrogen and progesterone. Okay, they regulate the menstrual cycle. They also develop and maintain the female sexual characteristics. Think about the breast, the distribution of fat, all the characteristics that are typical of a female. Okay, so they also, of course, develop breast and the uterus, but also they regulate the menstrual cycles. Progesterone is going to help the uterus to be ready for the implantation of a fertilized egg. Okay, the way I memorize that, estrogen is the one that is going to help to maintain the sexual characteristics of a female. And the progesterone, think about pro is in favor of gestation, so it's going to be ready when a egg gets implanted. But of course, things are not going to be in that preparation forever. It goes through cycles, aka menstrual cycle. In the male, we have the testes. Okay, they regulate the spermatogenesis, aka sperm production. They also promote and maintain the development of sexual characteristics in the male. They also cause the maturation of the reproductive male organs. Okay, there are other organs that are important also because they have secretion functions. For example, the adipose tissue, it's pretty important because they produce hormones known as the leptins. Leptins are important because they help with satiation, meaning that tells your body and your brain, okay, I'm satiated, I don't need to eat anymore. And here's the little trick. The more we produce, or the fatter we get, the less sensitive we become to these hormones, meaning that we need to eat more, and we need to eat more, and we need to eat more. So it becomes a self-feeding cycle. Okay, and also helps us, or I mean, in a bad sense, it helps us to be resistant to insulin, meaning that also they play a big role in the resistance of insulin and the development of type 2 diabetes. Okay, there are some hormones in the digestive tract that helps us with the peristalsis and also the secretion of gastric juices. In the heart, we have the brain natriuretic peptide. This is a hormone that is an indication when our heart needs to work harder. Okay, pheromones in the skin, and also in the kidneys. Think about EPO. Okay, the erythropoietin, and also the production of renin. All right, so now we're going to talk about some common endocrine disorders. Okay, this one is pretty important. Okay, acromegaly. It's different than gigantism. Okay, because this one, even though they are both the imbalance or hypersecretion of growth hormone, happens during adulthood. Okay, during adulthood. Okay, so it's the hypersecretion of growth hormone during adulthood. Okay, and if you guys can see here, we see two normal looking people, but then at some point we stop growing, right? But now the growth hormone is going to still be produced even though we stop growing, and it's going to usually target the spongy bones. That's why we see like broader features in the spongy bones of the face, but also the spongy bones of the hands, and they always get that look. Okay, in the other hand, we have gigantism. Again, it's the pituitary gland, and it's the hypersecretion of growth hormone, but it's during childhood and adolescence. We are still growing, so basically you put some booster, for saying in a way, so you grow so much, and you still are growing. Gigantism. Okay? Now, the opposite of this is pituitary dwarfism. There are different ways of being short stature. This one is from a pituitary origin. Is the hypo secretion of growth hormone. So they never grew. Okay, they never developed. Fun fact: the people that played the Munchkins in the Wizard of Oz, the original movie, they all had pituitary dwarfism. Now, an endemic goiter. A goiter is this structure here, and it's basically the thyroid that is enlarged because it's trying to compensate by the deficiency or lack of iodine. As I told you guys, the iodine is the PBJ of the production of the thyroid hormone. So the thyroid is trying to compensate by growing more to produce, or hoping to produce, more thyroid hormone, but it's not compensated enough because we lack of iodine, and it happens still to a lesser degree in developing countries because the availability of iodine in nutrition is not sufficient. Why we don't see it here in the US? Well, because it's present in all our diets. That's why you see iodines or iodized salt. Now we have the Graves' disease. This is an autoimmune disease, and now you guys know what autoimmune means. Okay, so our own immune system attacks the thyroid gland and produces hyperthyroidism, and also creates a goiter, but this one is from a different reason. The thyroid grows because it's getting inflamed and attacked. All right, so you see people with exophthalmos. Okay, they also have hyperthyroidism, meaning that they're nervous. They have hypertension. Their metabolism is always super fast, but also they're super nervous. And now we're talking about the effects of the thyroid hormone. Your heart rate is faster, your blood pressure is higher, you're nervous, you are always kind of underweight because your metabolism is just going overdrive. And this is why you look. Okay? Now, cretinism, and it kind of sounds like a harsh word. In fact, cretin comes from that, meaning that if someone is a cretin, sadly, they mean they're, for lack of a better word, they mean stupid, which is a harsh term. And of course, this is an old term. which means this is hypothyroidism in infants. They are born that way because they were not exposed to enough dietary iodine or they lack of the thyroid hormone in the body, which leads to severe intellectual disabilities, hence the name, which is still harsh to this date. These people tend to be slow, developmentally delayed, overweight, and they have a certain look. And of course, as you guys can tell by the look of this picture, this is something that is happening less and less. Okay, now we have Cushing's syndrome. Cushing's syndrome happens because in the adrenal gland there's an hyper secretion of cortisol. Okay, so the adrenal in the adrenal cortex we have cortisol, and basically these people are going to develop a moon face like you see it here, and these two people are the same. Okay, same thing here. Okay, there's a moon face, there's a buffalo hump, but also the cortisol in high levels tend to attack also the muscle in the extremities, so they have very thin arms, but also they have a big belly and they have stria in that belly. They tend to be tired, they tend to get colder, and of course their blood sugar is super high, and they are more prone to infections. Now we have diabetes mellitus or mellitus. So this one is the most common endocrine disorder, but think about which one. Type 2, right? Because this one is linked to our modern lifestyle, dietary intake, and basically overall our urbanized lifestyle. Okay, this one is more developed, while the type 1 diabetes is because it's from a attack on the beta cells of the islets of Langerhans in the pancreas, so you lack of the production of insulin. The way I remember this is type 1 diabetes is insulin dependent. Type 1 diabetes is insulin dependent, while type 2 diabetes, you're insulin resistant. And that's why sometimes you need metformin, which is a hypoglycemic medication, meaning that it's going to decrease your blood sugar. Okay? So this is a further explanation. Type 1 usually affects the child, and this is where we find it. There are different causes. Could be autoimmune, could be because of a genetic component, but also because of a virus. You get sick, and then your own body attacks those cells. Okay? So they have destroyed pancreatic beta cells, so they do not produce any or enough insulin. Okay? So they require insulin lifelong. Type 2 diabetes, sadly enough, you'll see it with younger population nowadays. There are causes still unknown, but also it's heredity, age, obesity, and sedentary lifestyle. So we're talking about our modern ways, okay? And they're insulin resistant, okay? Even they require more insulin, they need also other medications, but this can be also modified and minimized by diet, exercise, and lifestyle changes. And I mean, Ozempic has made a huge change in this. So mixed edema is a sign that you see very common in people with severe hypothyroidism. As we talked about, the thyroid hormone helps with heat production, metabolism, the reproduction capabilities, and overall like nervous system as well. So if this person has low thyroid hormone, they're not going to menstruate very regularly or at all. They're going to have dry skin. They're going to be tired. They're going to have muscle weakness. And since their metabolism is super slow, they're going to go weight, right? They're going to be slow. Their hair is going to thin out, and they're going to be intolerant to cold, okay? So what diabetes insipidus is the one that we talked earlier about, the hyposecretion of antidiuretic hormone. So this is the hormone that helps you pee less. So if you don't produce any or just little, you're gonna have a lot of thirst. You're gonna pee a lot because there's this hormone that is not gonna be present, and you're gonna start to pee and pee and pee MP, and you're gonna be tired because you're gonna have electrolyte imbalance. You're not gonna have enough volume. You're gonna feel dizzy because you have a low blood pressure, and you're gonna be dehydrated. So the treatment is lifelong ADH hormone therapy. So Addison's disease basically is the failure of either partial or complete of the renal cortex. So we lacking the mineralocorticoids, the glucocorticoids, and the gonadocorticoids. So people are gonna, of course, feel tired. They're not gonna have a lot of weight gain. They're gonna have gastrointestinal problems, and of course, they're gonna be slow. So you're gonna see these people have like a bronzing skin, like you see here or here, right? And pretty interesting is the Kennedys, Bobby and JFK had this condition. Okay, so this concludes our presentation. Thank you.